Welcome to Skills to Pay the Bills. Please join us for part 2 of Demystifying the Basic Facts Concerning the Affordable Health Care Act. We laid the groundwork in our last session, and we want to go deeper today with some examples and testimonies. Please welcome Shirley Liu, host and co-producer of The Real Secrets of Money and executive field chairman for the First Financial Security, Inc. And also please welcome Bobby Lee, Area Marketing Director for First Financial Security. Hello, Shirley.
Hi.
Good evening.
And Bobby, thank you.
Hi, Tia.
for
How
coming.
are you doing? Thanks for having us.
Well, we have a lot of questions, and we got a lot of feedback from the last show that you guys did. And so let's just get right into it. Bobby, I understand that there are new deadlines with respect to the Affordable Health Care mandate. Share with us what I don't know if it's one deadline or 2 deadlines.
Well, actually, the deadline is March 31st. And everybody has to, apply by then. Okay, but the
businesses too?
No, businesses. That's only for individuals.
For individuals, okay.
Okay.
All right.
Businesses
Good.
are still open.
Okay.
Okay. And the fact is that if you are applying but you're not done with your paperwork, at least you're in the process. They will extend that for you for 30 days. Okay.
Oh, okay.
So that deadline is a deadline if you've never applied. But if you
Okay.
are applying and it's being processed, that's fine. You're in the green.
And the way that people know that they're being processed, they probably have some kind of ID or
yeah,
a
they
case
have an ID
or
number, and
okay.
They're working it. Maybe they need more verification or something that
okay.
would need more time for them to process the paperwork.
Okay, all right.
Okay.
Now, once that deadline is over with for March 31st, is that all she wrote until October, or are there waivers or anything?
Well, don't quote me on this, but with the way things
a moving
have done,
target.
yeah, with the way things have gone, with the system being down at times, I wouldn't be surprised if they came out with some kind of extension. But the deadline is still March 31st.
Okay.
So, unless you have some cases where you just got married or something, then that would be exception to the rule, okay? But the deadline is the deadline.
The deadline
so
is the deadline.
if you don't apply by then, you got to wait till October 1st to apply for it next year.
Wow.
Yes.
Now, Shirley, let's move to you, and I'd like to get your feedback on this. What is the advantage, or is there a disadvantage, of a person having a certified representative to help them? What kind of mine lands could they go if they try to do this themselves?
Well, actually, some people do okay that they could do apply online.
Right.
However, I do see a lot of them calls me and said, we got a real serious problem, because once they apply, they don't know, one, what plans to pick. Or they ended up picking the wrong plans, and then guess what? It locks them down for a whole year. And then I would get that call and say, you know what, that's not what I wanted. I didn't know what I was doing, can you fix it?
Oh, so you mean that if you select a plan, even though you haven't paid for it, you're locked into that plan? Oh.
Yeah. And originally it was supposed to be, well, you're not locked into it till you pay.
That's what I thought.
But it's not always true the case. No.
Oh, okay.
Yeah, and so because I had many cases where it happened that they have not, I repeat, have not paid for it, and yet not understanding what the plan was offering. So therefore, they picked, just because sometimes when you hear the bronze, the silver, and all that,
Right.
they say, oh, there's no cost or very minimum cost. So people tends to look at cost, but not aware, you pay for what you get sometimes.
Right. That's
and
right.
so that's the deal.
Bobby, did you want to add
and
anything?
also, having a representative like us, we can actually sit down and dissect that plan for the client and let them know what their out-of-pocket is, what the deductible max out-of-pocket, or how much they're going to pay if they go to doctors or specialists.
Right.
We can actually explain all that to them. Whereas a lot of people that look at it, they don't understand,
Right.
what is covered. Like, let's say they have the different metal plans, the silver, the bronze, the gold and the platinum, what the percentage of the health insurance company is going to cover. Like for example, the bronze, they cover 60%, silver 70%, gold 80, or platinum 90%. So we're able to explain that to them so they understand if anything happens, how much money they will have to put out and what the insurance company is going to cover. So we can really explain it in detail, what those plans mean to them.
Okay.
And I think the other very important issues is that, a lot of time clients may need medication. Where you've got one client said, I never go to a doctor, and another one said, you know what, I'm taking high blood pressure medicine, I'm taking cholesterol medicine, I'm doing this, this, and this. So with those kind of things is we try to be aware of what to recommend, because that impact on prescription, it impacts how many times they go to doctors and all that,
Right, that's true.
And also when it comes to healthcare, it all depends on what area you live in. Certain areas you might have like a certain company that will have a bigger network versus another. And a lot of the time they say, you know what, I want to go to this doctor. So basically we have to find a plan that the doctor is part of. So we're able to do that so that they can be assured that if they pick that plan, they will still continue to go to the same doctor.
Right.
But if they didn't know it,
So because you guys are certified, I mean, you've been trained, you know how to do the research, and you really are demystifying some of the issues.
Yeah, and then we had another situation where basically a son went to me and said, look, my mom, dad needs health care, and so do I. So the question we have is that, do we apply together as one account, or do we apply together separately? Because they're kind of confused, as to how that rolls out. So then, as specialists here, we're able to sit down. Okay, let's take a look. How old are you? How much income do you make? Well, how much income does your parent make? You know what I mean? And working those kind of things, so we can give them better recommendation, as to what they should do.
What they should do,
yeah.
right. Shirley, this question is for you. After our last segment on healthcare, I got a couple of calls where people wanted to know how much you guys charge. And I said, they don't charge anything. They said, well, they're just doing this for free, who pays them? And I know that both you and Bobby, you're in DC, you're in Maryland, you're in Virginia, and you're probably in other states across the United States. Speak a little bit and make it clear to people that you guys do not charge for helping people get signed up on the affordable health care.
Yeah,
either that or tell me that.
I mean, we do not charge because we felt that since we are getting paid by the insurance company.
Okay, that's who pays.
That's who pays our salary,
Okay.
on that. So therefore, that's the reason why we're reaching out to community, And people are very shocked and surprised. And believe it or not, the reason they're shocked and surprised is because there's a lot of folks out there that is doing this, are charging the customer on top of still getting paid by, the
Really?
Yeah, and
Yeah.
so, that's happening right now,
Aren't they setting themselves up to wear orange for a while to do that? I would think that's kind of on the line, because you're not supposed to charge, is what I have understood.
That is correct. You're
Okay.
not supposed to charge.
Bobby, do you have any comments on that?
Like some places where they, just take care of your paperwork, and they would charge you just to fill out the application, because the individual English is limited.
Right.
So in that case, they charge on the service of providing a service, not actually signing you up for, the program.
Right.
So they charge, but then when we come in and we could do all that and give them a result within an hour,
Right.
They're a little shocked in that.
Feel a little shocked about that.
Yeah.
Bobby, you touched a little bit, a little earlier on the different metals. Can you kind of go back over that a little bit more, and can you share just a little bit more on what those metals mean?
Okay, well, the different metals, different plans, first they have catastrophic, but then the metal plans are bronze, silver, gold, and platinum. And what each plan means is if you choose a bronze, 60% of your costs will be covered by the health insurance. If you choose silver, 70%, gold, 80%, and platinum is 90%. So if you choose the highest plan, of course it's going to be the most expensive, and it's going to have more coverage with lower out-of-pocket costs.
Right.
But you see, one thing good about this program is that you could choose a silver plan if you have the tax credit. if you have a high tax credit with a, say, 94% cost sharing, it would actually cost you very little and be able to match the same as a platinum plan.
Oh, okay.
Because your out-of-pocket is covered with that cost sharing and the subsidies. So, that's where we can explain to people which plan is right for them. And, just to touch on what Shirley said earlier, a lot of people don't understand that. They don't understand that in order for you to get the cost sharing, you have to have a silver plan.
Right.
You can't choose a bronze plan and expect to have that. So, that's why I encourage a lot of people, don't try to do it on your own unless you know all the details.
That's right.
Okay.
Well, when you say the bronze plan, because I've kind of looked at that one a little bit, and it seems like most of the bronze plans are the HSAs, which is not like a pure HMO or a PPO.
Yes, and one thing about bronze plan is the deductible is really high.
Yeah.
It's ideal for, somebody's healthy, somebody's young, they know that they're not going to end up in the hospital, and, they don't mind that deductible, but the cost is much cheaper. So, it all depends on who's looking at what. I mean, if you think you're that healthy and you just need something just in case, but when you get in the hospital, the deductible could be $5,000-$6,000 or more. So you're paying less now, but you're going to pay more later.
Right.
But versus a silver or gold plan, you might be paying a little more, but if you get the tax subsidy, you're still paying less because the subsidies would take care of that, and plus the cost sharing will definitely take care of your out-of-pockets.
Right. This question is for both of you. Now that, as you told us earlier about the deadline that is upon us, have you discovered that more people all of a sudden, are you busy? You said earlier that you didn't have anything to eat when we were talking before the show started, and Shirley's hungry as well. So does that mean that you've got a barrage of people that are calling to get signed up?
Yeah, my office, if you came in my office the other day, you would see every desk had a client sitting. And then that's one going out the door, the other one's coming in. It's like a revolving door. It was the funniest thing that I've ever seen, Not only that, my phone's ringing off the hook, emails coming through, texts coming through. People's calling, and then one said, let me give you 10 more. I'm like,
oh my goodness. Wow, yeah. Well, Bobby, what about you? Are you experiencing that same?
Once I help one person, I got 5 other people that are, friends of theirs, and then even before I could help them, they're already telling other people. So every day is like, if I get home at 11 to 12 o'clock at night, that's early.
Right.
So, it's panic time. I mean, it's, a lot of people are seeing, and a lot of, because, we're helping people and they're just spreading the news. But you know what? Time is the essence now. They have to get it done.
They have to get it done.
And because a lot of them have done their taxes also, so now they're giving this and say, okay, now I know exactly how much I make. I need to see how I can get into this program.
Well, it's time for a short station break. We'll be right back with our special guest. So don't touch that dial.
Diet and exercise are never easy. Then again, neither is dying. Type 2 diabetes, heart disease, and stroke kill nearly 1 million people a year. You can stop it starting right now. It's your life. Listen to your doctor. Eat better, get moving.
Welcome back. You're watching Skills to Pay the Bills. Our discussion today is all about the Affordable Health Care Act. Let's welcome back Shirley Liu and Bobby Lee. Shirley, right before the break, you were making a comment. I'd like you to finish that, and then I have some more questions.
Yeah, you were asking, are we busy, and as you know, previously, someone always said, Shirley, you should get an assistant. Of course, I hire one, and then I hired 2. Well, even as of yesterday, I had 8 people working, doing this, and we just couldn't even still keep up with the stuff that we have,
Wow.
And it's just amazing, and I think a lot of time when we come in, we help the clients a lot because a lot of them may currently have health insurance. I have the story I gotta share you real quick.
Okay.
The story was there's this gentleman, he had a health care plan that he ended up went under as COBRA. So COBRA, 59 years old, husband and wife. So you can imagine the cost on us like $1,000 a month under what he was paying until yesterday when I was able to meet with him. But because of the kind of income that he had, where he came from, kind of got laid off a little at the job and combination of stuff. So his income has really drastically reduced. So in this particular case, I mean, it's gone from $1,000 a month down to like maybe $20,
Right.
which they were just like couldn't believe it, and so these are the kind of things that I think we can help make changes, that where we could do help, we do, make
to
a big
help.
difference. Yeah.
Okay, very good. Now I have a question because before the break, Bobby mentioned about, as you're working with the people, you're able to save them money for those in the past who had to pay tons of money, for health care. So I'm wondering if you're able to save in that way. What about other services? Are you able to offer other services? Because I know sometimes people, they don't have very much health care, but they also don't have life insurance or final expenses or other types of strategies.
Well, we are a broker, so we deal with over 300 insurance companies. So when those situations arise, we're able to help them with life insurance, retirement, safeguarding their finances, and we can talk to them about that and show them that what's available in the market, and be able to help them a lot in that department.
Right.
Yeah.
Sure.
And a true story happened yesterday. I mean, a client is now unemployed, no job, can't get a job. He's too old to get a job, too young to get Social Security. So there was no benefit in it for him at all. But through helping him find the health care plan, I discovered that he had a fund, a similar like a retirement fund, that he did not know that he could touch. He thought the rules was that he just could not touch it now.
Right.
And I was able to show him, I said, yes, you could touch it and give him away. They were like, oh my God, you mean to tell me we were able to put food on the table with what you found? And
Wow.
so it was just amazing,
That is amazing. I have a testimony, and this is something that has really touched my heart and actually been bothering me for several weeks. I know of an agent who had gone into a church about a month ago, and she was sharing about health and life products. And one of the gentlemen set up an appointment for her to come and visit with him like the following Saturday.
Okay.
This person was in their early 50s. That Wednesday, the person dropped dead of a heart attack. And it was just mind-blowing, on that.
But you
And so
should-
that's making a change for the family because, there wasn't a lot in there. There was enough to take care of burying him, but, other things. They had kids that are in college and mortgage and all that kind of
Well,
stuff. So it's almost like health and life kind of blend together.
It's,
Would you agree with that or disagree with that?
I agreed, and I'll take even one step further. We were able to even sit in front of clients, and the client said, you know what, I've been working for the government for the longest time. I'm okay with my life insurance. I've got FIGLY program, and I said, well, how much do you have? And he said, well, I have $248,000 that I could easily take care of my wife. And he's in 70 something, right? And I said, can I see that? And he pulled it out. Do you know what happened? His $248,000 FIGLY program went down to $4,400. His wife looked at him and she was like, it can't be. She said, you mean to tell me if you die tomorrow, I don't have enough money to bury you, let alone pay for the house? And it's so real
Because it
that
decreases, right?
yeah, it
Yes,
decreased.
it
And in this case,
decreases.
it shows a statement of how much he was getting. And he did not know any of this. But guess what? We discovered through other discussion. But
You
I
know.
just didn't know.
And you know what? We're here to educate and see what we can do for
To help.
Yeah, to help.
To help, that's right. Let's switch a little bit to small businesses because we haven't talked about that. What is the story on small businesses with this health?
Well,
care?
the small business, the shop is actually will not open till November of 2014, but businesses can still apply for the insurance on the marketplace.
Okay.
Okay.
All right.
And if they do, they can get as high as a 50% tax break Okay, but there are rules where business have to cover 50%, offer to 70% of their employees. Employees have to work 30 hours or more. But it's good because, let's say, I'll give you an example. If a business has, let's say, 25 employees making under $50,000, they can have a tax credit of up to 50% on their monthly premium.
Wow.
Subsidy. So
That makes a difference. That should make a difference in the bottom line there.
Exactly, and the business will have a tax break also. So these are some of the rules that the Affordable Care Act has that a lot of businesses don't understand. So that's where we come in. We can come to a business and evaluate what they have, and if they want to offer it to their employees, we can actually work with them to say, okay, you can control how much you contribute to the plans for your employees.
Okay.
We can basically show them exactly what they're going to put out and what they get back.
Right.
So if any businesses out there needs to that information, we're here to help them.
Right, that's good. And so the small business, now let me ask you, can a small business will get the tax credit? Can the employees still get a subsidy
Yes.
as well? So
Yes.
so they can get a subsidy
And the business
tax.
with tax.
Oh,
right.
okay.
Yeah.
Wow.
And you know what? The shop hasn't been advertised that much, because the system is not going to be up to November 1st, but they could still do paper applications.
Okay.
Okay.
All right.
And like I say, we can come in and sit down and show them all the plans and show them exactly how much it costs and kind of tailor the plans according to what their needs are.
What their needs are. Now you mentioned paper applications. Have you found that the paper application system maybe is quicker than the internet? Because some people are still having some challenges with the internet. I think from what I'm hearing, the part where you can determine what carrier to use, like that's working pretty good. You can find out. But there are other parts of it that still,
Eeny, meeny, miny, mo.
not working. So I'm wondering, is the paper way the way to go for right now?
You know what? I find from my experience, I don't do paper anymore.
Okay.
Because we are certified on the marketplace, we actually just call straight to the marketplace. Within half an hour, we have results for you. Okay. Picking a plan, and within 3 days you can pay for the plan, and 10 days after that you get your insurance card. If you do paper or online, one thing about is that
So you have clients that have actually gotten their insurance card, because I'm hearing some people that don't have their
one lady
cards.
last night, she went online, she waited 6 weeks, nothing. I sat with her for an hour, she got her plan, and now all she has to do is pay for that plan, and within 7 to 10 days, she's going to have an insurance card.
So you just made a telephone
That's
call
it.
and sat with her with the, okay.
I think it depends on where it is. I had
Yeah.
one had 6 kids, and a husband and wife. We went on with the live agent, and then we also went on the website. 5 times, all failed.
Yep.
And guess what happened? At the end, it was determined because you have too many kids, you have to send in paper app.
Right.
So in this case, it was 8 people in the family, so we had to end up doing paper app.
See, that happened to Michelle, who was on the show with us last time. Tried to talk with a live agent, and that young lady had to fill the application out 5 times because it just wouldn't submit, no matter what she wouldn't submit. So Michelle is ending up going to do it paper, because it just, so I guess it's situational, it just depends.
Oh, yeah. And the other thing is really important is that what's happening is that a lot of people better check your health insurance. I had a situation today, a client calls me and he goes, they are not paying my claims. They're not paying my claims that I had. What's wrong with it? Well, apparently his plan last year didn't meet the 10 essential, and hopefully Bobby will bring that up. This 10 essential, so guess what they did? They sent a notice out to all the clients and said, by the way, you need to go pick another plan. Well, like most people, guess what they do? They don't read the mail. They throw away the mail. They think it's advertisement.
Right.
So guess what he did? He went to the doctor, now he's got a bill over $6,000 and he's calling me.
Oh, no.
Yes.
That brings up a good point. Bobby, talk about what the significance of the 10 essential.
Well, the Affordable Care Act requires that all the plans now have to have the required 10 essentials, and what it is ambulance service, emergency services, hospitalization, maternity, mental health services, substance use disorder services, prescription drug coverage, rehabilitative services, preventive and wellness services, and I can't even say the word.
Pediatrician.
Services. And all the plans have to have that. And of course, the most important thing is even if you're sick, you can't be denied.
Right.
Okay.
That's good.
So if those plans are that you had last year doesn't meet these required essentials,
Wow.
most likely they're going to drop you.
Wow.
So that's why millions of people don't have health care because of that.
Because of that. Well, we're just about out of time, and I do want to let the viewers know that scrolling at the end of the show will be information on how you can get in touch with Shirley and Bobby. But today we want to thank you as we close for Bobby and Shirley helping us to demystify the Affordable Health Care Act. I want to encourage you to do 3 things. Number 1, for individuals who are seeking health care under the Affordable Health Care Act, the deadline is March 31st.
Yes.
So if you need help, contact one of the folks on this show to find out what you need to do. As I said earlier, the telephone numbers will be scrolling, and I also want to let you know this is a free FREE service. There are no charges. Number 2, don't be afraid to go and call or visit online the Federal Healthcare Portal or your state marketplace portal. The federal portal is www.healthcare.gov. And this website will direct you to your state marketplace if you cannot find it. My last piece of advice is this. Whether you like the Affordable Health Care Plan or not, it is now a moot point. The Affordable Health Care Act is the law of the land. And as any good law-abiding citizen, we should obey the law. Disregarding this law could put you in direct line for heavy penalties. My question to you is this: is this really a hill to die for? As we close our show today, as I said earlier, names and telephone numbers of where you can get free assistance will be scrolling on your television screens. Please take full advantage of the opportunity to have healthcare experts work with you one-on-one. I hope our program today has provided some helpful information and education to you. Thank you for watching Skills to Pay the Bills. We look forward to seeing you at our next segment. Bye-bye.